Health Committee. This session will be recorded so that you may come back to it later if you need, and so others who may have missed out on today's events will be able to come and watch it. Thank you. So now, at this time, please mute your mics for best sound experience. Otherwise, the feedback could interfere with information we will be sharing today. Without further ado, here is Mr. Christian Salas.
Hi, good afternoon, everybody. Thank you for making it out first and foremost, as is the case nowadays. Can everybody hear me? Right, that's a quintessential question that we need to ask nowadays. So give me a thumbs up, unmute yourself, say yes. All right.
Yes, all right, we can hear you.
Yes, sir.
Perfect. Good to hear you guys. Again, thank you very much. My name is, like stated, my name is Christian Salas. I'm an LMSW licensed master social worker, both in Texas and New Mexico, and currently serve as assistant professor of social work here at the Valle Verde campus, and have the distinct honor of serving as the chair of the EPCC Mental Health Committee. And first and foremost, I would like to really thank the excuse me, the Tahanu virtual events staff and my fellow mental health committee members for allowing us to put this together, and hopefully the first of many series that we can bring to you all to help inform and guide not only the things that we do on campus, but the things that can help out students, faculty, staff in the classroom and outside of the campus. So today's going to be very basic, kind of what is the mental health committee, right? We are often confused with another committee. Sometimes people are like, what is that? Who are you? Why are you? So I think it is best to start off at the beginning, right? In the beginning. So here's I always tell my students that I don't like using the term like, the learning outcomes or what to expect. I call it the spoilers, because it tells you what I'm going to talk about before I even talk about it. So it spoils the suspense of what is it that we're going to talk about. So here's the spoilers for today. We're going to talk about the humble beginnings of the Mental Health Committee here at EPCC. Who makes up the committee? Excuse me. What is the Mental Health Committee? Why we do what we do. And in that section, we'll talk about, it's not just, hey, we should try this, hey, we should try that. We actually have some data that helps us and dictates where we should focus our attention. We'll also discuss what the Mental Health Committee does and what it has done in its short tenure here at EPCC, and also talk about what's next. Where is our vision? Where are we pointing our focus in towards now? So the Mental Health Committee was actually created a couple of years ago through the Faculty Senate. Our previous chair, Ms. Carrie Van Hoot, had this vision of really emphasizing mental health in students. And so through mental health surveys and faculty surveys, which we'll discuss in much more detail here in a bit, this was brought to Ms. Rebecca Bell, the president of the Faculty Senate at the time, and it was deemed that this was a very important topic, and this was something that really needed to be paid attention to. And so Carrie was tasked with the creation of, and therefore the inception of, this Mental Health Committee. So who are we? As you can imagine, the members of the Mental Health Committee are varies. We vary from discipline, from campuses, and even from fields. We have people who are full-time faculty. We got people who are part-time faculty. We got members of our staff, members of counseling. We have some deans and some directors on our amongst our ranks. So when we put this committee together, and as we start formalizing and conceptualizing ideas, we want to make sure that we get as many perspectives on the table, that we have a varied view on what it is that we want to do and how we can go about doing so. So excuse the selfish or the selfless plug, but if anybody is interested on being a member of our committee, by all means, please reach out. I'll put my contact information here at the end. Again, just so that you guys have a point of contact, our meetings are every month, the last Tuesday of the month, from 3 to 5. Usually the meetings don't last that long. We go up to about 4:30 or so, just giving you being transparent. And we talk about from what we've been doing to what we can do from here on out. So again, little plug, if you guys are interested in joining and you feel that, hey, you know what, I can bring something to a table, which I know everybody can, by all means, please reach out, send me an email, shoot me a text, shoot me a call, leave me a voicemail, smoke signals, messenger pigeons, and we can definitely get you on board. And we would love to have um, your perspective, your view on the different topics that we discuss. And as you can see, we we are open to anyone and everyone. By bringing in full-time, part-time staff, counseling, deans, and people that are a part of administration, we can look at a particular problem, we can look at a particular idea and dissect it and infuse it from different angles. We can have people that are really good at coming up with solutions. We can come up with conceptualizations, but then people that are part of administration can really ground us by saying, well, you know what, that's a great idea, but this is how you can go about it. This is who you need to talk to. This is how you can go, how funding can get started. Search for this, search for that. So if don't feel that, oh, I'm just a this, oh, I'm this. No, no, no. There is no, oh, you must meet these qualifications to be a part of a committee. No, 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 no. If you are willing and if you have the time, we'd love to have you guys. All right. This is the why. When first created, like I mentioned, Carrie Van Hoot, our previous chair, started the not only the student mental health survey, but the faculty survey. And so what did we learn from this? We really learned that our faculty is our first line of defense. Our faculty sees our students on a daily, if not 2, 3 times a week. And so students build rapport. And I'm sure if you're a student, if you're a staff member, a faculty member, I'm preaching to the choir. And so what does that mean? It means that as faculty members, you might be the first ones that our students go to when facing a problem, facing a situation. It could be because they are not going to class, right? And you reach out to them. They might not turn in their assignment, or maybe an assignment didn't go as well as previous assignments. And so again, you reach out and say, hey, everything okay? I noticed that this assignment you didn't do as hot as the other ones. Or they might come up to you and just disclose that they had some issues. So the ball is now on faculty and staff's court. What do I mean by that? That do faculty members, staff members, my fellow colleagues, do they feel confident in establishing that conversation, starting that conversation, having that conversation with our students? In some cases, yes, but unfortunately, well, not unfortunately, let me rephrase that, but in more cases than not, faculty are not really confident in having that conversation. Now, why is that? Well, it can be a myriad of issues. One is we're not all trained as counselors and clinicians, right? Not everybody has a training of a counselor, of a social worker, as a psychiatrist. Completely understand that. So you might not have the training or the understanding of how to address something. But let's say you do. You feel confident in having that conversation. Where do you send that student? Because you're still a faculty member, you're still an employee, you're still a husband, a wife, a brother, sister, father, mother. You still wear multiple hats, you still have to do your things. So what happens? Well, the confidence then lies in, does the faculty member have the confidence, or have we provided our faculty with the resources to send students or refer students to an office within the campus or a resource outside of the campus? So again, I remember going through my orientation, right, when I first got hired. And I can assure you that I don't remember half of the things that we talked about. I'll be completely honest with you. Um, I've had to go back a couple of times to my dean's office and speak to our administrative assistants and really be like, hey, so what am I supposed to do with this and what am I supposed to do with that? And it feels like every time I speak to somebody, I learn something new about EPCC that I'm pretty sure at some point or another I heard about. So maybe this is, and now I'm just kind of talking as a tangent, but we can definitely find in these things that we learned, we can find ways in which we can build the confidence of our faculty, right? Even if it's just providing a link to resources, providing a website, providing a database. So the biggest thing that we found out from this survey is the faculty's and our staff's willingness to help our students. Again, preaching to the choir, right? We wouldn't be doing what we do if that wasn't the case. So we have colleagues that are willing to help our students, but are we providing them the resources? Therefore, are we helping build their confidence? Well, therein lies the question. And so we'll talk about this in a little more detail here in a bit when we talk about what the Mental Health Committee has done. But what about the students? So another component of what the Mental Health Committee does is the mental health survey, the student mental health survey. And what we have realized, and this is actually going to be the second uh, uh, lecture series workshop event to be hosted through our series, is defining mental health and mental illness and really separating the two because they're not the same. So what we realized and what we found out is that students are really affected by mental health. Now, mental health can be them getting a bad grade, them having a bad day, them having a an issue with a personal relationship. Personal could be with their partner, it could be with a friend, it could be with the family members. It could just be the stress of life. It could be they got a ticket this morning on their way to class and they were late to class and they had an exam that day and they didn't have time to finish the exam and they got a bad grade. So things start to compile and compact. And that could lead to having issues in the classroom. So this can be from having issues with attention, being able to focus in class, because the back of their mind, they're thinking about that stress, that relationship, those issues that are coming up. This can also be with attendance. Maybe they got to take care of whatever issue they have to take care of, and they don't show up to class. Now, I understand that with virtual classes, there's a little more wiggle room, potentially. But when we go back to face, or even if we have a hybrid class, we know that we have a drop rule. Now, obviously, I preach to my students communication and that I will work with them if something comes up. But then also, are we instilling that from the beginning? Are we creating those bridges, those open channels of communication? And even completion. Mental health in our students has really shown that it can affect not only the completion of assignments, the completion of a test, but even the completion of a semester or even a degree plan. So we want to make sure that, and again, what we have learned from the survey is that mental health issues are a real thing for our students. And these are things that affect the numbers. These are things that affect how our classes might be formed. I don't know about you, but when I do group assignments, there's always that groaning and moaning, that, not again. But the work out in the real world isn't just by yourselves, right? It's learning to work in teams and being accountable and being responsible and things of that nature. what better way to learn how to manage and to cope with these things than through assignments in the classroom? But I digress. We also found out that students that do present with mental health issues would be willing to attend services offered on campus. Not only on campus, but at their home campus. Excuse me. Now, I realize we have 5 campuses, 6 if we include the ASD. So if we have students that are going all the way to Missions El Paso, all the way to Trans Mountain, Northwest, Valle Verde, Rio Grande, ASC, whichever, however. But we only offer services. Again, let's say, again, through the survey that we realized students want to attend services in their home campus. So if they spend most of their time at Valle Verde, why would they want to go all the way to Mission del Paso or all the way to Northwest when they spend all their time here at Valle Verde? Especially when that mental health issue or that stressor is finances. And now they have to spend gas money to travel all the way to Northwest or whichever campus to seek help. So we're kind of aggravating the issue. Anyways, we want to make sure that, or let me rephrase that, we realize that our students are willing to go to these services. They are seeking these services. And sometimes, going back to the faculty survey, having the resources and being able to send a student outside of the campus to seek these services is not the best option. Why? Well, these services are expensive. Prior to working at EPCC, I myself was a therapist. I worked as a psychotherapist. I provided mental health, mental illness, and substance abuse counseling from adults all the way to elderly. I remember the first time I saw how much people paid to see me, I was like, wow, I couldn't afford coming to see me. So even places that have a sliding fee scale, in other words, they pay according to their income, it's still a balancing act between getting the services that I think I need or that I know I need, or paying the rent, um, buying groceries, putting clothes and food on the table for my kids, for my family, and then weighing the options, the pros and cons. Not only that, but believe me, as a clinician, I used to have a medical clinic right across. I could look outside my window in my office and see the medical clinic right across the street from my office. And if I had referred a patient for medical services because of medication or because I knew that if I was sitting there with them and something hurt, their attention was not going to be fully on me or on the work that we were doing. So I would refer them for medical services. But if I just sat down and be, hey, you know what, Mr. So and so, Mrs. So and so, let me refer you to Dr. So and so across the street. Um, can you go by the before our next session? Oh yeah, Mr. Silas, sure, whatever. Yeah, we'll definitely do it. The likelihood of them going is pretty low. I'm not gonna say zero, but it's pretty low. Even if I called, made an appointment for them, the chances increased. But in agencies where I've had medical providers in my clinic and I had patients and I did a warm handoff. In other words, let me take you to the doctor and have you set up an appointment, or maybe he has a time where he can see you right here, right now. Or the opposite, a doctor sees them and then refers them to me. Anyways, if we have services that are in campus, on campus, at the home campus, that increases the likelihood of our students going to seek these services and potentially learning ways to cope with these issues, which means more butts in your seats, more faces on your screen, but not only more butts on the seats and more faces on the screen, but more healthy minds that are there with full attention. And the likelihood of them completing a degree, completing your class, is much higher. So let's talk a little bit about what the Mental Health Committee has done and what we do. So every semester we have our faculty development week. And through the faculty development week, we put together what we call our mini mental health conference. In the past, this used to be a 2-day event. We used to have, when it was still face to face, we would, excuse me, we would have 2 days of just jam-packed events and different things having to do from student mental health, ways of approaching issues in the classroom, and student services, and how to identify depression and anxiety and PTSD, yoga, meditation, things of that nature. Since going virtual, we've done a 1 day event. These last, I believe, last 3 or 4 semesters have all been virtual. So we offer that to our faculty. Now, again, we realize that these are things that, um, even though we address once a semester, we try to stay with what is going on in the classroom, the things that we hear from our colleagues. Um, for example, the last couple of sessions or the last couple of faculty development weeks, uh, we focused on returning to campus, right? The pandemic, depression, alcohol, and substance use, the stigma of mental health in the pandemic or post-pandemic times. And even one of the third component of our series with the Tejano virtual events will focus on that. Actually, our third and fourth talk will focus on that. The third one will be on faculties and students' mental health in returning to campus. And the last part of our series will focus on what I call our cows, right? And just being present for our coworkers and for our students. COWS is an acronym, stands for Crisis of the Week, but can really be seen as how we just engage people and just asking simple question of like, hey, how's it going? Everything all right? Cool. Need a vent, anything of that nature? But again, that will be further down the line in our third and fourth installment of these Mental Health Focus Fridays series with the Tejano virtual events. The next one, especially after the August 3rd shooting at the Walmart here in El Paso, uh, the Mental Health Committee found it very important to help equip our faculty with mental health first aid. And this is exactly what it sounds like. It's providing basic understanding, basic skills of intervening if needing to in a situation where someone is experiencing a mental health condition. So the aim of mental health first aid is not to turn people into clinicians or psychiatrists or therapists, is to, just like any first aid, kind of putting a band-aid on it until the professionals show up. Uh, you might be the only one around at that time that could help assist a person that is going through a crisis. These have been extremely successful and extremely sought after. Not only that, but I hope you guys have received and seen your emails where we are bringing this back, and we have started registering people. And obviously, we are still offering this virtually, again to comply with CDC guidelines and also to comply with our EPCC protocols. That still doesn't devalue or dilute the value of these events. So go back to one of your community, the El Paso Community College or the EPCC community events emails, or and check out these mental health first aid sign up and registration forms. They are extremely beneficial. I even as a mental health professional provider have gone through it myself. I did this as a student back when I was doing my master's, and it's really great stuff. I mean, these are things that even us as providers learn in the classroom. It's a great way to identify what the issues are. It's a great way to help people destigmatize mental health, but also it's a great way to help people understand what an individual might be going through at a time of crisis, and depending on their circumstance and on their disorder and diagnoses. We have also created, through the work of our committee members, the mental health awareness, not only an email but a website. I'm sure you have noticed some emails that are coming from the mental health awareness website, email address, and talks about different peer support groups, about the mental health first aid, and different things that the mental health committee has been working on. We have also put together, if you go through the EPCC or the my.epcc portal, and where did I go? And go to services. I'm doing this on the fly. And look up health awareness, and it's actually right under the other tab between institutional calendar and my Tahanu alert information. You have mental health awareness. And so we have a website that we try to keep up to date with links to local resources, local agencies, and just tips here and there that will help you as faculty and staff and fellow colleagues build your confidence about where we can refer students. We have also put a link on the counseling website, the EPCC counseling website, with a database that is originally out of UTEP, the Empower Change Center, that works extremely hard to keep all their information updated from agencies, from um, social services, mental health services, assistance services, anything and everything. They've divvied it up from area code to type of service to the population to age group. I mean, they've really done a great job, and they've allowed us to really share that with our community and with our students and our faculty here at EPCC. And so that link is in the counseling website, the EPCC counseling website, not the counseling program, but our counselors page. Another thing that we have really worked with or worked at is creating peer supports group. Again, Carrie Van Hoot has really worked hard at getting people trained to become peer support group leaders. These groups also, invites have been sent out and are open to whoever is willing to attend. This last semester, or the spring semester of 2021, I believe that's the year we're in. Yes, yes. uh, the mental health committee helped one of our fellow students over at the in SGA uh, acquire a $1,500 grant to support um, her own peer support program that she created uh, through Manos y Corazón. And as the mental health committee served as kind of the mediator, kind of the middle person between the college and the agency, where we provided information, we really kind of got the ball rolling and put people in contact. And a couple of months later, they really liked the idea that our student had, and they were willing to fund $1,500 to help ensure that this program that our student created flourished and got off the ground. Um, Through some of our social work students, they also serve as kind of crisis interventionists, where they will sit in on some of the meetings, and in case some people are triggered under my supervision, they um, will serve as crisis interventionist and talk people through any crisis. Fortunately, nothing has come up yet, but that is also an opportunity for our students to practice what they learn in the classroom through an initiative that was fostered by the mental health committee. The last thing that we are currently working on, and is extremely, oh man, I don't have words for it. It's going to be great. I mean, it's awesome. It's an initiative that talk about the joining of two great teams. So the mental committee was working on a proposal paper to bring mental health services on campus. And again, we talked about this earlier of we don't just like sit here and go like, "Ah, we should do this. Hey, we should do that." No, it's all informed, right? We got this information from our students, so we're listening to our students. We're listening to our faculty, and again, through our previous chair, Carrie started formulating and got this concept paper off the ground with the help of myself, Isela, and Isela Robertson over at the grants office, and some of our other committee members got this concept paper together and said, hey, you know what? Our students really do experience mental health issues. And as I previously stated, this is hurting their attendance, their attention, and even the completion of their work and degrees here at the college. So they are willing to go to these services, but we need to bring them on campus. We can't just be like, oh, great, here, go there. No, we need to bring them on campus. So this concept paper made its way all the way up to Dr. Smith's office. Um, During a cabinet meeting or a leadership meeting with the university, the college, Dr. Paula Mitchell was tasked and had been working on with Oscar Vasquez, our district counseling coordinator. We're working on a social services center. So the social service center uh, is looking at helping students that are having issues with, let's say, for example, homelessness, with finances, with food insecurity, things of that nature. Well, the cabinet said, hey, this would be a great way for you to join forces. And we have. Under the guidance and the leadership of Dr. Paula Mitchell, we've created this task force. Myself and I believe about another 4 or 5 members, about 3 members from the mental health committee and 3 members from the social services group got together and we created this task force that is working on formulating and conceptualizing what this mental health and social service center, we don't have a name for it yet, so don't quote me, but what this is going to look like. And so we're looking at having this kind of one-stop shop uh, for everybody to, or our students to go and seek mental health services, or if they have any questions about how they can get assistance with paying the rent, with insurance, with insurance for their kids, for themselves, where they can go. Instead of trying to find their own way through, have a way where we can help them, guide them through the path. Not only that, but this will serve as a great way to foster the relationships that we have with our local universities, with UTEP, with NMSU, by providing an internship site for social work and counseling students. Whoops, sorry. Of course, something popped up. There we go. And not only for NMSU and EPCC, but also, sorry, UTEP and NMSU, but also for our students here at EPCC, our social work students, our counseling students, or early childhood development, um, any degree program that could benefit from this. We are now creating a learning environment for our students. Like I said, this is in the conceptualization stage. We're looking towards hiring a consultant to help us conceptualize this and bring this idea to fruition. But know that this is something that is in the pipeline. Um, and we are extremely excited about having this, going from a concept and a thought and a vision to getting the ball rolling and now having the job description created, bringing a consultant in place, starting to build partnerships with our local universities, thinking about how this can be an all-inclusive one-stop shop for all our students. But that's not the end. Just because, hey, we've kind of met the vision, right? That when first tasked by the faculty senate, our committee uh, was tasked with creating these mental health services for our students. Well, just because that initiative or that vision is coming to fruition, we can't just sit back and be like, oh, we're done. No, 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 no. we again are now really working to push this mental health and social service initiative through with funding, with resources, and put everything together so that we have a great place for our students to go. And not only that, this is going to help build the confidence of our faculty to say, hey, you know what, we have this in-house, we have this here, and this is going to be something that will help alleviate that not necessarily a doubt, but that lack of confidence in our that our faculty might have when it comes to directing and guiding students as to where to go. We also are working and will continue to work on fostering partnerships and relationships with other committees around the university, the college, as well as groups. Um, be it through helping foster or helping students garnish funding through outside sources that our committee members might be aware of, or helping, power in numbers, helping push an initiative that is brought forth by one of another group, another ad hoc committee, or another task force that is on campus. Again, we have this varied view because of the various disciplines and the various fields and departments that our members are part of, that can help the different committees and the different groups really bring their ideas to fruition. Now, I know everything seems that we're focusing on students, and understandably so, but we can't forget the mental health of our faculty, our staff. Again, we are the first line of defense, and we have been the first line of defense. I don't know how many times I've sat in lecture, I've sat in my office, I've sat in a little bit after our virtual classes or before our classes, and students just talk, right? And they say, oh, Mr. Salas, this and this is going on, or students text me, and I understand the issues that students are going to, but we as faculty members also need to be aware that our mental health matters. As staff members, our mental health does matter. Let me give you an anecdotal story. When I worked as a court investigator for probate court number 1, I would go and do our annual visits to individuals that have guardianship over their family members, right? Because they were incapacitated under the law. Anyways, I remember going to this one family whose child was uh, the child did not walk, was used a wheelchair, required skilled nursing. Um, I don't recall the diagnosis, but their boy wasn't able to talk, wasn't able to move on his own. Um, Anywho, when talking about how they've been, like, oh, we took them to the movies, we took them to the park, we took them downtown, we went here, we went there. I'm like, wow, man, you guys are doing great. I wish everybody was like this. This is great. But what are you doing for yourselves? They kind of were taken back by my question, and so I asked again. I'm like, but yeah, but what are you guys doing for yourselves? They replied, I, I don't know what you mean. Like nothing. Like why not? Take some time. You know, go for a walk. Watch it. Oh no no no, Mr. We can't. We can't. What about? And I said, I understand. I get it. I get it. But you're burning the candle from both ends. Now think of it. Think it through this perspective or through this lens. If you're burning the candle from both ends, the candle's going to run out faster. Meaning, you guys are working your butts off. Completely understand it. But at the same time, if something were to happen to you guys, either health wise or whatever wise, who is going to take care of your child in the way that you take care of them? Now, that's a very drastic way of saying, hey, if you as staff members, as faculty members, don't take care of yourselves, who's going to be there to teach your students the way that you teach them? So I'm sure everybody here takes pride in what they do, the work that they do, either in the classroom, in the office, regardless of your position. You take pride in what you do. And no one's going to do the job like you do. I know that people can replace me, but I can assure you I I do things my way, and I love doing it my way. I know my students like the way I do things, and no one's going to do it the way I do. And so something were to happen to me, that's not there. Now, that could also be a very selfish way of thinking, like, oh, I'm the best and I do things the best. Not at all. But think about it that way. We want to make sure that this mental health committee is about not only the students, but about our faculty and our staff. This is not the EPCC Student Mental Health Committee. This is the EPCC Mental Health Committee. In other words, we want to make sure that we promote the mental health and the mental well-being of our students, our faculty, and our staff, from all the way up top to everyone else, right? From that first year student that steps into the classroom for the first time at EPCC, all the way up to Dr. Serrata, right? To the board, our board of trustees, and on down, and everybody in between, employees, students, administration, all alike. That's what we're looking at. We're not looking at just, oh, well, we worked on this mental health and social services. Well, we're good. Job well done, guys. Pat on the back, thumbs up, high fives all around. Whew, that was good. Now what? No, no, no. We keep on trucking, right? But that's why we need you all. We want to make sure that we don't stagnate. We don't keep on reinventing the wheel. And so if there's an issue, if there's something else that needs to be taken care of, by all means, reach out. What else do we need to do? What else can we do? So, like I said, that's the mental health committee. That's how we came to be. That's what we've done. And that's a little glimpse as to what we will continue to do. Talk about a selfish plug. That's me and my little 4-month-old, going to be 5-month-old little baby boy. I have my contact information out here for you guys. By all means, please do not hesitate to reach out. My email, csalas69@epcc.edu. Office number 915-831-2469. As you're all aware, you can leave a voicemail, and that goes all the way to what call it. The voicemail goes into our email, so there's none of this. Oh, I didn't get your email. I didn't get your voicemail. Nope, not an excuse. I'll get them. Again, our meetings are every month, last Tuesday of the month from 3 to 5. Currently, they are being held through Teams. Again, if you're interested, even if you have questions, man, shoot them. Even if you have suggestions, we're here. We're open. Let us know. Um, with that said and done, any questions, comments, concerns that you might have? And again, I mean, this could be, I'm open for anything and everything. What's the meaning of life? When's that? I don't know about that one.
Are there any questions at this time for Mr. Salas? Any questions at all? I see a lot of thank yous in the chat, Mr. Salas. Thank you for your wonderful presentation today.
No, thank you guys.
Well, if there's no more questions, I would like to invite you to the other mental health TVEs that are coming up. So today we had who and what is the EPCC Mental Health Committee. And then on October 22nd, we're going to have what is mental health and mental illness. October 29th, we'll be having the mental health of students, faculty, and staff upon returning to on campus. And then any cows, checking in can go a long way. Would you like to expand upon that one? That is such an interesting title.
Yeah, definitely. So um, uh, I always throw off my students when at the beginning of each week, I ask them, like, any cows? And they're like, what the heck are you talking about? So the cows is something that I started with when I was a child therapist. And it's a cute little way of kind of getting people to think of where they are, right? Any situation that might be keeping them from being there at that point in time. So like I mentioned, COWS is an acronym, COW, for Crisis of the Week. And it's really just about checking in. Again, we don't want to make everybody a therapist, a mental health provider, a clinician, But just showing that you're present, showing that you're there, that you genuinely care about somebody, just again saying, hey, how's it going, everything all right? Maybe
That's so cool.
it opens up the conversation to, you know, being able to maybe direct somebody to the services that they might need, or to just vent. So yeah, that's kind of the rationale, or the reason behind that.
Oh, that's awesome. Well, y'all make sure y'all come and check these out. It's going to be a fun
Hmm.
session, I can tell.
Yep,
Um,
yep.
so at this time, I would also like to invite everyone to download our OLA PDF if you haven't already. Uh, it has loads of services available to you. I can go ahead and share that part of our screen real quick. Let's see. On the OLA guide, one of the ones for students I always like to point out is the Student Success Online Tutoring is open 7 days a week from 9 a.m. to 11 p.m. Plus, there's lots of other providers. Did you know that the Writing Center is available online on Saturdays? Or perhaps you're not familiar with Sunday Numbers, which is an awesome program that's hosted by our EPCC math instructors, Mr. Azasi and Mrs. Azasi. Also, there's other services here, including a link to y'all's mental health resources. Woo!
All right.
And, and so we strongly encourage you to check it out. The other thing I would like to share with you guys today is the Tahanu passports. So give me just a second to pull up that information. Here it is. All right. And so if you haven't checked it out already, Tahanu Passports is really cool. So what it is you join us at Tahanu virtual events each week. And at the end of the session, we'll send you a link and you get points towards your own free medallion. And so I put today's code in the chat. If you haven't done it yet or anything, it's not too late to join. You sign in with your EPCC credentials, the part before the @EPCC, and then your regular EPCC password. This code will be valid until midnight tonight. And I just saw that we had a question in the chat for you, Mr. Salas. It says,
Yes, ma'am.
how do you de-escalate a tense situation?
Yeah, that's a loaded question. And thanks, Lucia. I mean, you reminded me of my patients when you're like, all right, we're about to leave, and anyone have anything? And those I'm like, well, and they drop. I call it like dropping the bomb.
Sorry.
No, no worries, no worries. But it really depends. The first thing you want to do is make sure that you make some, you leave some space. You don't appear threatening. You kind of set the environment up, right? You don't make any sudden movements. And but first and foremost, you ask the person if they want to talk about it, because sometimes people react differently to different situations, and sometimes they don't want to talk about it. They want to be left alone. So I know we have our protocol, and we have the scenarios as per EPCC, and contacting the police department and so on and so forth. But yeah, what do you do in the meantime? Definitely, we can try and talk. We can try and have give the person room. Again, ask questions. Try and ascertain what's going on. um, Validate their feelings and emotions. Not like, oh man, you look pissed, but hey, it really looks like this really upset you. Yeah, it really pissed me off, and man, do you want to talk about it? And so I think in those situations, not doing too much is better. When they say like a little bit goes a long way, at that point, reflecting, talking about what you see, kind of even at that point, making them maybe come back, because maybe they were so um, entrenched in what the situation is. Like, hey, you know what, like, remember, you're in a good place, bud. Like, we're in a safe place. How can I help you? What can I do for you? I just want to get the heck out of here. You're more than what I'm not standing in your way, but understand that we're here to help. We're here to provide whatever we can do to help you out. And is there something that I can do for you right now? Can I get you some water? Can I get you, do you need to call somebody? Would you like me to call somebody? So I think in cases where a situation like this arises, one, people are not sure what to do, right? Hence the question. And the other side is people sometimes try to do too much. And that, in essence, can also aggravate the situation and make things worse. So giving the people some space, talking in a calm voice. It never helps to raise your voice. They always talk about when you want to have a conversation and someone is yelling, keep your voice down. Don't try to up them one up them. That's just going to cause them to increase their volume. Calm, don't make any sudden movements. Keep your hands where people can see them. Maybe sit down, put your hands on the desk. So again, non-threatening, non-judgmental, non-abrasive way, and just listen. From the non-verbal and the verbal cues that the person is giving you. But at the same time, keep yourself safe. That's the number one thing. You don't want to stay in a situation where you yourself are in danger. If you need to get the heck out of Dodge, then get the heck out of Dodge. Your safety is paramount. Um, and that's when you let the professionals handle that situation and then inform them of anything that you might have become aware of during that situation that can help them in de-escalating it on their side.
Thank you, Kristen. That's great advice. Thank you.
Yeah, and I mean that's kind of like the really concise version. We can definitely I think we can even do a whole series just on de-escalating situations, but that's kind of just the how to attack it from right off the bat.
It's definitely good information to have, I do have to say. So does anyone else have any more questions for Mr. Salas? Oh, well, just a bravo. Good job today, Mr. Salas.
Thank you all.
So I would like to thank everyone for coming today, and I would like to thank our wonderful presenter for presenting for us. I'd also like to invite you guys to next week. Let me see here. It's right here. So next week's session is going to be on October 22nd at 1 p.m. in the same link. We're going to have what is mental health and mental illness. We often hear the terms mental health and mental illness used intermittently. However, there is a difference. Join us to have a candid discussion about what constitutes a mental health issue and a mental illness, and what resources are out there for everyone at EPCC. So that's good for people who maybe are seeking help, as well as people who want to help others. So it's definitely going to be a must-go-to. Also in this room, we're going to be having our Happy Math Hour. So today at 3 o'clock in this room, we're going to be having an exam 2 review. And then next week in this room, we're going to be having exponential logarithmic functions for Math 1314. And Math 1324, we're going to have a system of equations. I want to wish you all a wonderful weekend. I hope you have a good day and hope to see you back soon. Thank you very much.
Thank you, everybody. Much